All right. Well, hello, everyone. My name is Lisa Archibald, and I'm the director of the School of Communication Sciences and Disorders. And we're very excited to have you here joining us today. We train speech language pathologists and audiologists in our graduate professional program. These are healthcare workers that we are preparing to join our systems and support people in terms of their hearing and their balance and their communication and their swallowing. Our program is growing. We're looking forward to inviting a large cohort of students in and being ready for them to arrive in September. And we also, as part of our training program, operate the H.A. Leeper Speech and Hearing Clinic. And May is Speech and Hearing Month, and so we offer webinars in when we're thinking about sharing about information about speech and hearing. And today, I'm very pleased to have Dr. Jack Scott presenting on living with tinnitus. Dr. Scott, please go ahead. Thank you.
Thank you, Dr. Archibald. Welcome everybody to the presentation, Living with Tinnitus, Understanding the Ring in Your Ears. As Lisa said, my name is Jack Scott. I'm an assistant professor at Western University. I'm also a clinical supervisor at our in-house clinic, supervising audiology graduate students in tinnitus remediation, hearing assessment, and hearing aid fitting and treatment. I also am a certificate holder in tinnitus management from the American Academy of Audiology and am the director of the Auditory Wellness Research Lab at the National Center for Audiology. Today, before we begin the presentation, what I wanted to sort of share a little bit was about my journey with tinnitus. So I do have tinnitus. I've had tinnitus for about the past 5.5 years. I've been an audiologist for 25 years, but it wasn't until November 2019 that I actually began to experience tinnitus. And this was at a previous job where I was working on some experimental hearing aids. I held the experimental hearing aid up to my ear before the safety settings were activated up to my left ear, and the device caused a very loud feedback or squealing sound that resulted in tinnitus on my left side. The tinnitus sounds like a whistling or a tea kettle going off. And at first, I just assumed that this would go away on its own, as tinnitus can, or ear noises can go away after being exposed to loud sounds. But this seemed to persist. And then, as we all know, in March 2020, the pandemic struck, and in many cases, people were regulated to their home or to their houses in quiet environments. And given that stress, in another medical situation that I sort of ran into, my tinnitus sort of exacerbated and seemed to stick with me. Being an audiologist, I actually have, training in tinnitus and understood tinnitus, but even I suffered from tinnitus, as in most cases, in many cases, tinnitus is not something that we can get rid of, but something that we actually learn to live with. And it wasn't until about 6 months ago that my tinnitus seemed to quiet down, in that it sort of became something in the back of my mind that I didn't focus on or I didn't notice. And actually, the day that I didn't notice it, I actually began to listen for it or to look for it because I'd lived with it for so long. Uh, and so what I wanted to sort of finally add before we move on to the next slide is that my tinnitus is louder now. I was working on a presentation for giving tinnitus, which made me think about tinnitus, and it caused my tinnitus to get louder. But I know that over time, that tinnitus will subside again, as long as I do not attach any sort of emotion to the tinnitus and just sort of allow the tinnitus to be there. Now, we can't really have any sort of presentation on tinnitus without actually talking about the auditory pathway or familiarizing you with the hearing pathway. And just to kind of bring everybody up to speed with how we hear, sound is picked up by the outer ear, or pinna, the part of the ear that sort of sticks out. It sort of traps the sound travels down the ear canal to our eardrum or tympanic membrane, moves some little tiny bones in the middle ear space, and then it stimulates our hearing organ, which is called the cochlea. And inside the cochlea are some very fine hairs that bend and shear when the sound waves come in that cause electrical activity, and that electrical activity travels up the auditory pathway to the auditory cortex within the brain, and it's perceived as sound. And this will become a little bit more relevant when we get into actually some of the physiology and pathophysiology of tinnitus. So what is tinnitus? And one of the questions that I sometimes get is it pronounced tinnitus or is it tinnitus? Well, both ways of pronouncing it is correct. So depending on how you like to pronounce it, that's perfectly fine. Tinnitus is the perception of sound in one or both ears or in the head when no external sound is present. Some people hear their tinnitus in their ears. Some people hear the tinnitus actually floating out in front of them. Some people hear the tinnitus exactly in their head. And so this is referred to as ringing in the ears, although many people experience tinnitus as different types of sounds. Some people experience tinnitus as clicking. Other people experience it as roaring or whistling. Again, my example is a tea kettle. Some people experience tinnitus as cicadas or a high tension wire. The point is that many people can have their own sort of perception of tinnitus. It can be intermittent. It can sort of be there intermittently, maybe less than once a week, sometimes more than once a week, sometimes continuously. It can actually sound like tones, like a single tone or multiple tones. For some individuals, it can sort of, as I mentioned, sort of be in the back of the mind and never really be there. It can be a subtle experience, but for other people, it can be shattering and severely impact their overall quality of life. But how many people have tinnitus? Well, Statistics Canada in 2019 reported that 37% of adult Canadians actually experienced tinnitus in the past year or experienced some sort of tinnitus within the past year. Of those individuals, 7% report their tinnitus to be bothersome. And so what does bothersome mean? Well, bothersome means that the tinnitus will negatively affect aspects of their life. It may be one aspect of their life or multiple aspects of their lives, aspects such as sleep, concentration. It may impact their mood because the tinnitus is something that's always present. The tinnitus may give them a sense of anxiety because the tinnitus is present and they're not exactly sure why the tinnitus is there. And for some individuals, it may lead them to be isolated or to not engage socially with other individuals. Because when they go out, if they know they have the tinnitus, it may distract them. It may result in them not being able to concentrate. And so they find it best just to stay home and not interact with anybody. And so tinnitus, before we move on to the next slide, what I want to sort of try to separate here is the difference between ear noises and tinnitus. And so ear noise can be either transient, temporary, or occasional. Transient ear noise is something that most everybody has experienced before. And so this is a phenomenon where you perceive ringing in the ears or ringing in a ear for, let's say, a matter of seconds, sometimes a minute. The hearing will appear to muffle, the ringing will come on, and then it will appear to resolve itself spontaneously. This can happen very randomly. There doesn't always need to be a cause to this. And in many cases, we don't exactly know what causes this, but we know that it does happen in a large percentage of the population. This is something that you do not need to be worried about. This is a normal occurrence. It is something that happens to everybody. Temporary ear noise is categorized as something where you might be exposed to loud sound, to either gunfire, or if you've been using heavy machinery or woodworking machinery, or been to a loud concert or a loud club, you might leave that environment and your hearing may appear muffled and you may hear ringing in your ears. This typically will resolve itself, although it does indicate that some damage has occurred at the hearing organ, otherwise known as the cochlea. And again, this should resolve itself after a while. Sometimes it does, sometimes it doesn't resolve itself. And this is called temporary. Occasional ear noise, where the ear noise lasts at least 5 minutes, but can occur at least or less than a week. And again, very similar to the temporary ear noise. Now, tinnitus is the ear noise that is a little bit more constant. And so intermittent tinnitus may be for somebody tinnitus that is continuously there, but maybe they don't notice it or appear to hear it unless they sort of listen for it or they're in a very quiet environment. Constant tinnitus is always present to the individual, present and heard in a quiet environment. And this is where treatment may be needed for the tinnitus to help try to resolve it, because it may again be impacting various aspects of the individual's life. Now, with tinnitus, tinnitus is broken down into sort of two different types. The first type is called primary tinnitus, which is the tinnitus that we're going to focus on more today. The other type is called secondary tinnitus. And secondary tinnitus is tinnitus that has some sort of underlying cause that has resulted in the tinnitus. This is typically a cause that is identifiable, and with appropriate remediation, physician evaluation, and physician or medical remediation can cause the tinnitus to go away. This can sometimes be benign, sometimes this can be severe. Primary tinnitus is the other type of tinnitus, and this is tinnitus where there is no known source for the tinnitus, although there's a high percentage of individuals that have primary tinnitus that also have hearing loss. So there is believed to be a relationship between the hearing loss and the tinnitus. And when we get into primary tinnitus, we'll talk about the relationship and sort of the idea behind why primary tinnitus starts and how it becomes sort of this constant type of tinnitus that people experience. And so what are some possible causes of secondary tinnitus? Secondary tinnitus can be caused by something as benign as earwax buildup or something as benign as temporary fluid behind the eardrum. It can also be caused by something very serious, such as a tumor on the hearing nerve or called an acoustic neuroma. It can also sometimes be caused by high blood pressure or vascular issues in the carotid or artery or the jugular vein that run along the neck and bring blood to the brain and take blood away from the brain. While stress and anxiety in themselves don't cause tinnitus, stress and anxiety can actually make the tinnitus more worse or more noticeable. Just like with any sometimes ailment that we have when we're stressed or when we're anxious, our ailment may seem more severe. So if we have a headache or we have some sort of chronic pain, when we're stressed or when we're anxious, we may actually, that chronic pain may feel worse than it does on other times. Now, when should you be evaluated by a physician? It's recommended to consult a healthcare professional if your tinnitus is new to you, if it is unilateral, that is, it is in one ear, if it's pulsatile, or if it follows the heartbeat, or if it accompanies any other symptoms such as hearing loss, dizziness, or facial numbness. Now, these, again, if any of these things occur, it's recommended that you see a healthcare professional for follow-up. Now, primary tinnitus is diagnosed when any secondary causes have been ruled out. So when we can say that the tinnitus is not because of earwax in the ear, the tinnitus is not because of fluid behind the eardrum, it's not because of any sort of acoustic tumor or growth on the auditory nerve, that's when something is categorized as primary tinnitus. And as I mentioned, primary tinnitus is seen in 80 to 90% of individuals with a permanent hearing loss. And permanent hearing loss can occur for a variety of reasons. Permanent hearing loss can happen just because of the normal aging process. It can happen because of being exposed to loud sounds that have caused damage to the hearing organ. It can happen because of viral or bacterial infections. And it can also happen because of some medications can actually damage the hearing organ, and these are called ototoxic medication. But what causes primary tinnitus? Now, in the past, we used to think that primary tinnitus lived inside of the ear, in that there was something happening inside the ear that was causing the ringing, that then if we treated the ear, that we could get rid of the ringing altogether. And there are some anecdotal evidence of individuals that had ringing in the ears or primary tinnitus so severely that they opted to have their hearing nerve severed. They thought deafness would be preferred over the ringing in the ear. And actually, when the auditory nerve was severed, the tinnitus still persisted. And so in that case, it wasn't that the tinnitus was actually in the ear, but the tinnitus has actually moved into sort of a higher level within the auditory pathway or within the nervous system. And so the theory is that because of the hearing loss that's happening in the ear, it's resulted in changes along the auditory pathway up through the auditory cortex. And these changes in the auditory pathway has caused the system, for a variety of reasons, to try to listen or try to identify sounds. Now, there's a lot of theories out there and a lot of animal experiments that are ongoing to try to identify exactly where the tinnitus is happening or what sort of neurophysiological changes in the auditory pathway results in the tinnitus happening, to see if there's a way to sort of resolve that. But right now, there's no definitive answer on where tinnitus is occurring. And so for the current treatments of tinnitus that we're going to sort of talk about, we're not going to really focus on how to get rid of the tinnitus, because currently there is nothing that actually can cure tinnitus. But the strategies that we're going to talk about are strategies to try to help someone live with the tinnitus or help decouple the tinnitus from an emotional response. Now, as I mentioned, because hearing loss and tinnitus have this relationship, one of the things that we need to do when a patient comes in with tinnitus and with hearing loss is we try to need to determine what is the primary complaint of the individual. And so we have some questionnaires available to us to try to figure out, is the patient's primary complaint the tinnitus, or is the primary complaint the hearing loss, to make sure that we address the patient's concerns, the patient's primary concerns first when working with them. Sometimes, because hearing loss results in tinnitus, sometimes by treating the hearing loss, we can actually reduce the perception of the tinnitus, but other times we need to focus on the tinnitus first before we can try to address the hearing loss for the patient. The impact of primary tinnitus on the individuals is actually, for simplicity, broken down into two categories. We either call the tinnitus non-bothersome or bothersome. And non-bothersome tinnitus is when the tinnitus has little to no impact on the overall quality of life or health status of the individual. Again, those individuals that have the ability to push the tinnitus into the back of their mind and not really focus on it they uh, until they focus on the tinnitus or try to listen for the tinnitus, while other individuals may have bothersome tinnitus. And again, this is the tinnitus that impacts the overall quality of life or health status. About 10% of the population actually experience chronic tinnitus. So 1 in 10 people have chronic tinnitus. And of those, about 80% of individuals would be categorized as non-bothersome. And so again, the tinnitus is not bothersome. 20% of the individuals have the bothersome tinnitus, again, where it may impact their overall quality of life. And even within those 20%, there are different gradations of severity of the tinnitus. So the tinnitus could be mild, it could be moderate, it could be severe, or it can be debilitating. And we have questionnaires, hearing handicap or tinnitus handicap questionnaires, that allow us to try to tease apart how bothersome the tinnitus is for the individual. Some of the strategies or some of the thought process between why a tinnitus may be non-bothersome for some individuals and why it may be bothersome for other individuals. Some theories out there believe that those individuals that have non-bothersome tinnitus, the tinnitus is kind of relegated or stays within the classic auditory pathway, the pathway where, again, we have the hearing organ, we have the auditory pathway that goes up to the auditory cortex, and the tinnitus sort of stays in that auditory pathway. So there's a perception of the sound within the auditory cortex or the hearing part of the brain, but yet there's no emotional component with regard to the tinnitus. For patients with bothersome tinnitus, the thought is that additional areas of the nervous system are actually involved. The limbic system, for example, which controls basic emotions such as fear, pleasure, and anger, as well as the autonomic nervous system that controls unconscious processes, things that sort of happen without thinking about them, such as breathing and heart rate. And one of the prevailing models in tinnitus treatment revolves around something called the neurophysiological model of tinnitus. That is the auditory system. Again, the auditory cortex receives this initial sound of the tinnitus, and then additional areas become involved in the process. Areas, as I reported, such as the limbic system that supports memory and emotion, and the autonomic nervous system that controls blood pressure, heart rate, and breathing. The hippocampus, which is part of the limbic system, is associated with functions of feeling and reacting. And another component of this system as well is the amygdala, which is thought to be part of this bothersome tinnitus pathway, which processes emotions, particularly fear and anxiety. And the limbic system is also involved within the fight or flight response of the body. So just to kind of bring it back, the idea is that patients with bothersome tinnitus have an emotional component attached to the tinnitus, which then gives it preservation and actually heightens the awareness of the tinnitus for some individuals. The way that I sort of describe it sometimes for people is it's like a scratch that you can't itch. So if we have a scratch, it's there, it's something that or an itch that you can't scratch. Sorry. If you have an itch and it's there and it's something that you can scratch, but if, for example, if for some reason you're not able to scratch that itch because you're sitting in a theater, you're at some sort of event, and you're not able to scratch that itch begins to grow and become more noticeable and more noticeable and more noticeable over time. And then because you're sort of focusing on it, it seems to get worse and worse and worse. As we go through the presentation today, you'll see some topics of treatments that come up relevant for trying to, as I mentioned, decouple the tinnitus from this limbic system in the way that we're trying to remove the emotional component from tinnitus. Some various psychological factors that are consistent or that are thought about or considered when treating tinnitus are cognitive factors, habituation, attention, and learning. And so there's several sort of factors thought about with regard to tinnitus. With regard to cognition or cognitive aspects, the thought is that people have developed inappropriate ways of thinking about tinnitus. So, for example, they may think the tinnitus is something that indicates something severe, something bad, because they haven't been evaluated for it by a healthcare professional, and so they think something is catastrophic. It's a negative thing, and so they keep sort of thinking about this. They may not have been able to habituate to the tinnitus, and so being able to sort of push the tinnitus into the back of their mind, or they may have an inability to shift their focus away from the tinnitus. Again, sort of having that hand in glove way of thinking about habituation, or they've learned a response to the tinnitus. So they've learned to get anxious when they hear the tinnitus. They've learned to get stressed when they hear the tinnitus. And so the tinnitus, again, sort of seems to exacerbate some of these emotional components. Some of the topics that we're going to talk about today with regard to tinnitus and some types of tinnitus treatment that are out there are educational counseling, sound therapy, mindfulness-based intervention, cognitive behavioral therapy, some lifestyle change recommendations, and then also some considerations from pharmacological and pharmacological and non-pharmacological interventions that may have been tried for tinnitus um, without really much overall success. So in any sort of guideline that's out there, when you're looking across tinnitus treatment or tinnitus remediation, many, if not all, the guidelines recommend some sort of educational or counseling component. And so that may involve just information about what is tinnitus, what can cause tinnitus, what aspects are, or what causes tinnitus to be exacerbated. Also within this educational component, individuals may learn about different types of treatment therapies for tinnitus, such as cognitive behavioral therapy or mindfulness-based meditation or mindfulness-based stress relaxation for tinnitus. And they may also learn about different methods of sound therapy, such as hearing aids or sound enrichment. And so I say to you, congratulations, because you are kind of in that first step for educational counseling or learning about tinnitus just by attending this presentation today and getting a foundation and knowing what tinnitus is and knowing what strategies are available for tinnitus treatment. That is sort of the first step. And for some individuals that have mild bothersome tinnitus, just simply knowing that tinnitus is there, tinnitus is not something that you need to worry about because it's not caused by some sort of secondary aspect. It's not a secondary tinnitus, but a primary tinnitus that is just something that is part of who they are. It kind of allows them to have the permission to release some of the anxiety that they have about the tinnitus. With regard to sound therapy treatment for tinnitus, Hippocrates, who lived during the 5th century BCE, actually had an initial observation about tinnitus. He said, "Why is it that the buzzing in the ear ceases if one makes a sound? Is it because the greater sound drives out the less?" Tinnitus has been known about and documented about for thousands of years. There's actually documentation in some texts from ancient Egypt that mention a sound in the ear. And so this is something that humanity has lived with for generations upon generations. And sound therapy is actually sort of one of the types of therapy treatments that's available that helps many individuals try to reduce the perception of their tinnitus. And the goal of sound therapy at its very basic level is to try to decrease the contrast between tinnitus and the background. And in that, what we want to do is be able to interfere with detection of tinnitus. And I have an icon of a candle here because the analogy that we typically use is if you have a dark room with all the lights turned off and you have a candle in that room, the candle reflects the tinnitus. And so the candle appears to be very bright because it is the only source of light in that room. But then if we turn the lights on in that room, the lights turning on being sound enrichment in the environment, then the candle is less noticeable because there's contrast between the candle and the light in the room. And so the purpose, again, of the sound therapy is to try to reduce the perception of the tinnitus. And so sound therapy, and we'll talk about different types of sound therapy or different types of sounds that can be used. The goal is, as I mentioned, sort of the ability to bring noise into the environment to be able to make the tinnitus less noticeable. And so we can bring the noise up so that the tinnitus is less noticeable. What that may do is make it a little bit easier for the individual to sort of tolerate or habituate to the tinnitus. Now, there's several theories out there. Some theories say that we should actually use the noise to mask out the tinnitus, although one other theory by Jastroubov and Jastroubov says that the noise should not mask out the tinnitus completely. What the noise should do is actually be at the same level or slightly lower than the tinnitus. So the tinnitus is still slightly perceptible, which then allows the brain to be able to habituate or get used to the tinnitus. And again, the goal with this is to try to have the brain habituate to the tinnitus so it's less noticeable in the background. Now, when I first started practicing, one of the questions that one of my first patients, when I began sort of working with tinnitus patients, asked me, and because I was a newer novel audiologist sort of in this space, didn't know the answer to this, the patient asked, I already have a sound in my head. Why would I want to add another one? And as a new clinician, I didn't have an answer for this patient. And so when I say adding a noise into the environment, that noise does not have to be anything. It does not have to be a white noise. It does not have to be a pink noise. It can be any sort of noise in the environment to try to take the attention away from the tinnitus. And so we use the term sound enrichment when we talk about these types of sounds. So it could be a soothing sound, any sound that makes you feel better. So, for example, ocean waves, thunderstorms, even the sound of Gregorian chants in the background can be a sound that provides a sense of relief and provides a sense of relief from the tinnitus itself. It could be a background sound, so it could be a white noise. It could be a pink noise. It could be a sort of a steady state shh sound in the background. And again, the idea with this sound is that it reduces the contrast between the tinnitus and quiet. The sound could also be an interesting sound. It could be any sort of sound that draws your attention away from the tinnitus, that keeps you from focusing on the tinnitus. This could be a talk radio show. It could be um, music. It could also be a podcast. It could be listening to books on tape. It could be any sound that sort of takes your attention away from the tinnitus, as I mentioned, so that then you're not focusing on the tinnitus. And when you're not focusing on the tinnitus, hopefully the tinnitus doesn't appear to become louder. Another sound therapy recommendation that we have for patients is hearing aids. So as I mentioned, there's a high percentage of patients that have tinnitus that also have hearing loss. And so anecdotally, even in the past, when we did not have any sort of strategy for putting a sound generator into a patient's hearing aid, even patients that just wore hearing aids by themselves without any sort of sound enrichment sometimes found improvement or lack of perception of their tinnitus. Because what is the hearing aid doing for an individual that has hearing loss? What it's doing is it's amplifying sound in the amplifying sound that so that that sound is more audible to them. And when that sound becomes more audible to them in the environment, it can actually help mask out the tinnitus. And studies, there has been research studies to show that individuals that have permanent hearing loss that have tinnitus actually show an improvement in tinnitus handicap when they're fit with hearing aids versus those individuals that have permanent hearing loss that are not fit with amplification. And hearing aids today, one of the strategies that or one of the functions that we have inside of them, which is phenomenal, is we actually have the ability to add sound generators in the hearing aids. So we can combine both the enrichment of sound by providing amplification of sound, but also add a sound enrichment component as well by providing background noise to reduce the contrast between the tinnitus and the noise to make the tinnitus less perceptible. In the past, when I first started practicing as an audiology, we either had hearing aids for patients or we had sound generators. And so when we were sort of taught to treat patients, we were taught to treat patients with a sound generator first to try to remediate or resolve the tinnitus as much as possible before providing amplification for those individuals. But now we actually have both. We have hearing aids now that have provide the amplification and also have the sound generator in addition. And so it kind of provides sort of the best of both worlds for individuals. Another treatment that's been shown that has been shown or recommended for individuals with tinnitus is something called mindfulness-based intervention. And mindfulness-based intervention is something that was created back in the 1970s by Dr. Kabat-Zinn. It's called mindfulness-based stress reduction. And this was sort of designed for individuals suffering from chronic conditions and stress. And as I sort of mentioned before, while stress doesn't cause tinnitus, stress can exacerbate tinnitus. And so the idea behind this is that if we can reduce the stress through this mindfulness-based intervention, ideally we can reduce the perception of the tinnitus or make the tinnitus less loud for individuals. So there are individuals that have taken this mindfulness-based intervention or mindfulness-based stress reduction and actually taken it and modified it such that it is something recommended for individuals with tinnitus. And as they go through this mindfulness-based intervention, the intervention is geared towards patients for tinnitus. I'm going to sort of digress a little bit here just to sort of add, there is still some underlying thoughts that chronic tinnitus is similar to chronic pain in that these are both chronic conditions that don't go away. And in essence, chronic pain for some individuals is a brain phenomenon, just like the theory behind tinnitus is that it becomes, for chronic bothersome tinnitus, it becomes a brain phenomenon. There's data out there that show for individuals that have amputation, let's say limb amputation, they actually can have what's called phantom limb pain. And so the patient no longer has, let's say, the hand, but yet in their mind, they feel pain in that hand that is no longer there. And so because of this sort of similar thought process between tinnitus and chronic pain, then the thinking or rationale was let's take treatments for chronic pain and apply it to patients with tinnitus. Mindfulness-based intervention for tinnitus helps individuals sort of observe the tinnitus without judgment. So see the tinnitus without attaching any sort of emotional component to it. Become aware, be in the moment about what emotional responses are occurring from the tinnitus. And again, through this process, hopefully be able to reduce stress and anxiety that will reduce the tinnitus. And 2 out of 3 random control trials looking at mindfulness-based interventions on tinnitus actually did find significant decreases in tinnitus distress for individuals. The other thing that's recommended for individuals for tinnitus by the American Academy of Otolaryngology head and neck surgery is cognitive behavioral therapy. And so this is provided by psychologists, counselors, and social workers. I put sort of a caveat on this because while audiologists are not sort of trained to give cognitive behavioral therapy as part of the interventions that we apply or provide to individuals, there may be some aspects of cognitive behavioral therapy that are actually part of this. So some techniques within cognitive behavioral therapy, one is cognitive restructuring. And basically this is identifying negative thoughts about, let's say, the tinnitus, and then realizing the thoughts are there, challenging those thoughts. So examining the evidence for and against these thoughts. Are they based on facts? Are they based on feelings? Are there other ways to look at the situation? And then replacing those with sort of balanced thoughts. So developing more realistic and constructive thoughts. For example, this is unbearable, to a more balanced thought. This is uncomfortable, but I have coping strategies that can help me manage my tinnitus. Another aspect of this is behavioral activation, and that is actually increasing pleasurable activities in your daily life. So taking up a new hobby, reconnecting with friends, going for walks, some relaxation exercise that I talked about to reduce stress. In addition, adding sort of a mindfulness component to it as well. Education. And we sort of talked about that a little bit previously. And then thought records. So taking some thought records about your tinnitus. How was my tinnitus today? How much did it impact my life? Or how much did it not impact my life? Right? Was today a good day? And those thought records are good because if you have a day where you're saying this tinnitus, I cannot bear it. I cannot stand it. It's going to be with me forever. You may be able to look back at some of your thought records and say, no, there have been times when my tinnitus was not as bothersome, did not have much of an impact on my overall quality of life. Some lifestyle changes to think about with regard to your tinnitus. First and foremost, as an audiologist, my recommendation is to protect your hearing from noise. And so if primary tinnitus is very closely connected to permanent hearing loss, what we want to do is to make sure that we try to maintain overall hearing health. And so in those loud environments where you might experience noise-induced hearing loss or get exposed to very loud sounds, we want to protect your hearing from those environments. Manage stress as much as you can in your life because of that relationship between tinnitus and stress. And again, the stress exacerbating the tinnitus. Some other guidelines or recommendations that you might see out there are reduce caffeine, reduce alcohol intake, reduce high sodium foods, and reducing saturated fats. And so just in essence with this, it's just having an overall healthy lifestyle, because if we have an overall healthy lifestyle, our stressors will reduce. We will hopefully have the ability to think more positively, and by improving our thought pattern, hopefully improve the distress that the tinnitus has on our life. Staying physically active. Not smoking is one as well. Anything that can impact your vascular system, because the hearing organ is very sensitive to vascular changes. Anything that you can do to improve your vascular health through exercise, through reducing smoking or smoking cessation, reducing alcohol intake, reducing sodium foods, anything that can improve your cardiovascular health may overall may improve your perception of tinnitus or reduce the negative aspects of the tinnitus. And then prioritizing sleep. And as you go through and look at various different types of guidelines or recommendations for tinnitus remediation and education, one very important aspect is sleep hygiene. And so I just sort of put out on a slide some descriptions of various things that you can do to improve your sleep hygiene to help you get a good night's sleep. So having a set pre-bedtime routine, if you need to, taking a warm bath before going to sleep, making sure that your bedroom is a cool, dark space, performing some relaxation exercises to try to, again, reduce the stress, reduce the anxiety before falling asleep. Do not engage in any activity that stimulates your body or your mind before bed. We've all heard, don't take your smartphones to bed, right? Anything that sort of keeps the mind going. We want to give our minds the ability to reduce or to calm down prior to falling asleep, and not consuming alcohol or caffeine prior to going to sleep. So alcohol can impact the uptake of melatonin, which is important for maintaining sleep. And then also using a fan or white noise machine to interfere with your tinnitus. There's also apps out there that make white noise that may be able to help you. And then also going to bed and waking up the same time each day. So here I'm going to add a few things just to talk about some of the recommendations with regard to pharmacological intervention. I'm not a physician. I cannot diagnose. I cannot treat pharmacological intervention. And so I sort of put that out there. But one thing that came out in 2014 by the American Academy of Otolaryngology, Head and Neck Surgery, was a document that they put out to provide tinnitus guidelines and recommendations for physicians and also audiologists or anybody who works with anybody with tinnitus. And what they did was they evaluated the literature, the research that was done to look at should something be recommended or not recommended. So, for example, educational counseling was something that was recommended for patients with tinnitus. Pharmacological intervention was not recommended for the treatment of tinnitus. And so there were no studies out there that showed definitive benefit from taking medication to resolve or reduce tinnitus. This looked at antidepressants, anticonvulsants, anti-anxiety medication, the injection of steroids into the middle ear space on the other side of the eardrum, or even the injection of lidocaine, which is a pain or a local anesthetic on the other side of the eardrum as well. Now, I have an asterisk next to antidepressants because, while the antidepressants may not alleviate the tinnitus, the antidepressant may alleviate the depression the individual is having. And if the depression is reduced, then that may also reduce the perception of the tinnitus, not because the depression is causing the tinnitus, but because if the individual has depression, they may be fixating on things that are depressive, such as tinnitus. And when we fixate on the tinnitus appears to become louder. The other thing that the American Academy of Otolaryngology looked at when they evaluated the documentation was, what about over-the-counter intervention? So if you've ever done a search on the internet to look at tinnitus remediation or treatment, you will be bombarded by recommendation or homeopathic medication for tinnitus. Ginkgo biloba is something that herbal supplements, melatonin, zinc, lipoflavonoids, garlic, honeybee larvae, other vitamins and minerals are out there that are suggested or pushed for tinnitus remediation. And again, these are not recommended. There has been no data to show definitively that they have helped individuals with tinnitus. There may be anecdotal evidence, but there is nothing from what's called a randomized controlled trial to show that tinnitus can be remediated from this. I have an asterisk next to melatonin because melatonin may help with sleep. And as I mentioned before, if we get a good night's sleep, we can actually tackle things, more difficult things. We have more resilience. And so therefore, if you get a good night's sleep, it may help with your perception of tinnitus. If you are thinking about taking any sort of over-the-counter medication, I strongly recommend that you consult a healthcare professional or your physician prior to doing so. But what can you do today about the tinnitus? And so what I'm going to kind of show you are there are several different types of apps out there if you have a smartphone that kind of push their ability to be used for tinnitus. There's two in particular that I'm going to suggest to you. One is called the Resound Relief app, and one is called the Widex Zen app. I'm going to focus on the Resound Relief app, not because I'm providing you with the recommendation to use this one, but yet for you to take a look at kind of what aspects are within this app. And very similar to the Widex Zen, they kind of have similar aspects. But in 2020, there was a study that came out that looked at tinnitus treatment, tinnitus related therapy, and found that there was over 250 smartphone apps in the marketplace that's touted that they were sort of designed for tinnitus. So the Resound Relief app is something that's created by a hearing aid company, but you do not need a hearing aid to be able to use this. It provides educational information about tinnitus, some tips and tricks for coping with tinnitus, as well as links to tinnitus organizations and associations. Again, you don't need a hearing aid to be able to use this. You can just stream sound to a headphone or stream sounds to speakers when we get into the sound aspect. They also had support from an individual named Dr. Jennifer Gans, who is a clinical psychologist who does provide mindfulness-based tinnitus stress reduction. And they also received input from the National Center for Rehabilitative Auditory Research at the Veterans Affairs in the States. And I sort of put this in there because there is a tinnitus management model out there that is put out by the Veterans Affairs in America. And so they sort of reached out to the experts as they were developing this. One aspect within the app, and again within the Widex Zen app, is something called Learn, where it has education and counseling. And as I mentioned before, the American Academy of Otolaryngology Head and Neck Surgery says that clinicians should educate patients with persistent bothersome tinnitus about management strategies. And that's what this app does, similar to kind of what you've learned about within this presentation. And so what is tinnitus? How common is tinnitus? What are some common therapies for tinnitus? Within the app as well, it does provide some sound therapy or sound enrichment. And so they have a wide variety of different types of sounds that you can play, that you can mix together to try to find those sounds, whether they're soothing sounds or background sounds, that will help reduce the perception of the tinnitus or make the tinnitus less noticeable. Another aspect of the app is some meditation. It provides some meditation strategies. So again, the idea being that if we can reduce stress, reduce anxiety through meditation, we may be able to reduce the perception of the tinnitus. They also have sort of deep breathing exercises within the app. They also have imaginary soundscapes, and then activities nudging. So similar to cognitive behavioral therapy, where you want to increase your activities, right? Going for a cup of coffee, meeting with a friend, taking up a hobby. They actually have aspects within the app that will provide nudging for individuals to be able to do those sorts of things. They also provide other aspects like strategies for changing thought patterns. So as I mentioned, sort of how do you reframe your thought patterns about tinnitus, and then as I mentioned, sleep and sleep hygiene is very important for hopefully reducing the perception of tinnitus. So they also have in this app something that some guidance on improving your sleep hygiene. The next slide that is sort of up right now is a slide that has different models of tinnitus management. And there's two QR codes that I have up there right now. The top QR code will send you to a website for a tinnitus management known as Progressive Tinnitus Management. This is put out by the Department of Veterans Affairs Canada, in the United States. And so one of the top complaints of service individuals when they come back from deployment is tinnitus. And so realizing that tinnitus is one of the primary complaints, a lot of effort has gone into providing recommendations and guidance for individuals with tinnitus. And so because this information is, or because this work is funded by the US government, this information is free of charge. And so you can actually go to the website indicated, or go to the QR code indicated to be able to access some of their resources. The other one is something called Tinnitus Activity Streaming. And this is put out by Dr. Richard Tyler, who is one of the leaders in tinnitus experimentation, evaluation, remediation. He's at the University of Iowa, and he has had decades of experience working with tinnitus patients and creating tinnitus programs. And the second QR code, the QR code on the bottom in the website underneath tinnitus activities treatment, will take you to all his information, which is free of charge, that you can download. And then finally, the third one is tinnitus retraining therapy. This one has been around for several decades. This one is sort of behind the paywall, but TRT therapy has been around for quite a bit. And progressive tinnitus management, tinnitus activities treatment, tinnitus retraining therapy, they all use education, sound enrichment as part of their their therapy. It just varies kind of on how that information is conveyed. And so, what can you do about your tinnitus today? Again, if possible, be evaluated by a physician. If you have not been evaluated by a physician, if you have a hearing loss, trial a hearing aid. You may find benefit from the hearing aid in bringing up the overall environmental sound and helping to mask out the tinnitus, as well as reducing the stress of not being able to hear, or some of the anxiety that goes around not being able to hear, will then hopefully alleviate some of the tinnitus. Incorporate sound therapy when possible, either an app, a white noise machine, or a fan, anything that can provide, or listening to talk radio or a podcast, anything that can sort of help alleviate some of the perception of the tinnitus or distract you or take your attention away. Reduce alcohol intake. Practice relaxation techniques, whether it's mindfulness-based meditation or other types of relaxation. Improve your sleep hygiene. Don't shy away from day-to-day activities. So if you can, still do those day-to-day activities. Take your attention away from the tinnitus. Don't just stay isolated where the tinnitus becomes the dominant force within your life. And then work on practicing changing your thought patterns. So while I know as someone with tinnitus, this is easier said than done. If we can reframe our thought pattern around tinnitus, if we can decouple the emotion from the tinnitus, hopefully we can reduce the perception of tinnitus. And so I'll sort of leave you with a quote that's sort of in the tinnitus circles. I struggle to find the author of this quote, but yet I found it very profound. I have tinnitus, but tinnitus does not have me. And so I, as an individual, I have tinnitus, but my tinnitus does not have me. I also have my email address. So if you're interested in asking questions or learning more about tinnitus, feel free to reach out to me. You know, Sometimes we have research that revolves around tinnitus. Currently, we have nothing ongoing, but if you're interested in knowing when some research may become available, feel free to reach out to me. And with that, I will end the presentation.
Thank you very much, Jack. That was a great presentation. We just have about 2 minutes, and maybe people will need to be on their way. I'm going to put some questions, and I'll ask for just brief answers to them if you can manage. So, is it a damaged nerve?
So it's may not be a damaged nerve in the ear. What's damaged in most cases to again start tinnitus is damage happening within the hearing organ, otherwise known as the cochlea. And so there are hair cells that may be damaged that are resulting in what's called auditory deprivation, or sound is not getting to the brain. And so this lack of information getting to the brain is causing what's called upstream changes in the physiology of the auditory pathway. So it may not be a nerve damage per se, unless, of course, it's a nerve that's damaged because of an acoustic neuroma or a tumor of the hearing nerve. And that's obviously something that needs to be checked out by a physician.
Does it have a certain frequency? And then can a sound canceling mechanism target that frequency? Would that work?
It varies from individual to individual as far as the frequency is concerned. So the thought is if you can find your tinnitus, can you create a tone that is 180 degrees out of phase to that tone? In many cases, typically not. However, that being said, there are some strategies out there for tinnitus where you will have a white noise, and then you will find the tone of the tone of the tinnitus, and you will put a gap of sound in that white noise where the frequency of the tinnitus is. So you have stimulation around the tinnitus, but not at the tinnitus. And so this stimulation around the tinnitus will cause what's called lateral inhibition, which will then turn down the gain in the auditory system at that tinnitus frequency, hopefully then reducing the perception of the tinnitus.
Has a link to menopause been found?
That's a great question. I mean, potentially there may be some hormonal changes. I have not done any search to see if there has been a link. That doesn't mean that studies aren't happening or ongoing. I think that's a very good question. I don't know the answer to that, but if you will send me an email and ask me that question, I will do my due diligence to find an answer for you.
And a relationship to migraines?
Potentially, yeah, there might be a relationship to migraines, or it may not be that the migraine is causing the tinnitus, but it may be that the migraine, when you have the migraine, the ringing in the ear, not the ringing in the ear, but the tinnitus appears to worsen per se. That being said, it may, if we were to do a look for a correlation between migraines and tinnitus, we would probably see a correlation, not because the migraine is actually causing the tinnitus per se, but because there may be a correlation of the tinnitus being more bothersome for patients with migraines because of the electrical storm that's happening within the brain.
Mhm. Are earworms a kind of tinnitus, or there's something else?
I want to say it's something else per se, where I don't think it's the tinnitus like the persistent or chronic tinnitus that we talked about. It may be something else altogether.
You mentioned about tinnitus being new or noticeable and wanting to seek a healthcare professional. Should we be looking for a physician, an audiologist? Who needs to see us?
So, if you are unable to see a physician, the first, just because of the availability, the sort of the frontline healthcare individual that might be able to help you is an audiologist. So you could always see an audiologist first, and they will help make a determination if a recommendation to see a physician is there. They may be able to, through a case history and through an assessment of your hearing, help determine if this is primary or secondary tinnitus based on kind of what you report. And if they have any concerns because of how your tinnitus is presenting or because of what they see within your hearing results, they will make that stronger recommendation for you to go see a physician. So again, if you need to see someone quickly or right away, I would go see an audiologist because you could probably get in to see an audiologist sooner than a physician.
It seemed to me that the therapies you were describing, Jack, that people might work with an audiologist to find a sound therapy or the counseling, that they might take a bit of time working with an audiologist to address their tinnitus.
They could. I mean, they could. You have because of kind of the availability that we have for smartphones, you could try to do it yourself. But because we are trained in tinnitus remediation as audiologists, you could always seek out support from an audiologist for that. Um, it's not that there are experts, there are audiologists that are experts in tinnitus. We all receive some sort of formal foundational training in tinnitus, but some audiologists may feel more comfortable working with tinnitus than other audiologists. So if you are interested in finding an audiologist that works with tinnitus, I would just, call around and see if the audiologist takes tinnitus patients.
Is tinnitus progressive?
It may or may not be. I mean, it doesn't have to get worse. It can, again, ebb and flow depending on the situation, but there is no guarantee that it has to get worse for individuals.
Uh, and so there's a few other things. And so having a massage, can that help being tired related to TMJ? Can hitting your head, those kinds of things, be related?
So sure. So TMJ, there may be there is a relationship between some types of tinnitus and TMJ. Again, temporomandibular joint issues may be a cause of secondary tinnitus. And so if you do have TMJ issues, it may cause secondary tinnitus. So that means something to have a consultation with your physician or orthodontist or dentist about. With regard to head injuries, definitely head injuries may result in tinnitus or may exacerbate tinnitus, because if there is any sort of musculoskeletal injury, sometimes that can have uh, uh, cause tinnitus for patients. Again, probably more secondary tinnitus than primary tinnitus, but it can result in some tinnitus as well. And as far as massage therapy is concerned, um, you know, anything that causes you relaxation may help reduce the perception of the tinnitus.
And I think we're wrapping up. Can you test drive a hearing aid?
Yes. So you can definitely test drive a hearing aid. So many practices will allow you to trial a hearing aid. There may be a nominal fee for trialing the hearing aid, for fitting and dispensing the hearing aid on it, but you don't have to, when you trial a hearing aid, you don't have to always purchase the hearing aid. Clinics will have sometimes a 30 or 45-day trial period with the hearing aid because it is a large purchase. We realize that sometimes you need to try these things out before actually making the commitment to spend the money for them.
The question around being tired and tinnitus also has this comment about, is it all in my head? And I wondered, as someone who also has tinnitus, whether you might want to speak to that kind of thinking.
I think to say tinnitus is all in your head is, I'm going to use the word flippant. While thought patterns and can exacerbate tinnitus, tinnitus is there. You can't think your way out of tinnitus completely, but hopefully you can, by changing your thought pattern, your thought processes, make the tinnitus less noticeable or less bothersome for you.
And okay, can acupuncture help?
So there are a few randomized control trials that have shown some benefit for patients that suffer from tinnitus with acupuncture. Um, it's one of those areas that's still relatively new, and so while there may be some anecdotal evidence, there's not the strongest evidence out there. That being said, if you're comfortable with acupuncture, you could always try it. It may be beneficial for you.
And what a brand of headphones any reason to think that would be something?
Uh, that causes tinnitus? I'm not
There's
sure.
a related question about, is there an association with increased use of AirPods? So perhaps that's it. Is it, or maybe it's to do with your sound therapy, so maybe sort of in that range.
So there could, thinking about the question or sort of the comments, a couple of things. One, there has been shown to be an increase in hearing loss for AirPod use because we're kind of wearing these things all the time. And so whether it's sound enrichment, sound therapy, or even listening to music, you want to make sure these levels are low enough so that when you're listening to them for long durations, they're not causing any sort of undue hearing loss. So one of the things that came out when Walkman first came out, as well as with AirPods or earphones, that um, we did see sort of an uptick in hearing loss because people had these things in their ears and the sound was being focused into the ear. I would just make sure that you turn down the level or reduce the amount of time that you're exposed to whatever it is you're listening to through the AirPod.
Connections to linear, perhaps, and environmental allergies, two different questions.
So the linear device, and I kind of get those two confused. There's another device that starts with an L as well. So I'm going to describe both devices. There's a device out there within the States that allows for electrical stimulation of the tongue while listening to um, kind of sound sources or sound information. The idea with this is that you're stimulating something called the vagus nerve, which is a cranial nerve. Stimulation of the vagus nerve or activation of the vagus nerve has been shown to facilitate learning. And so again, with this idea, what they're trying to do is they're trying to pair listening to sounds with activation of the vagus nerve so that patients learn or relearn not to focus on their tinnitus. There's another product out there that again starts with an L that I can't recall that I don't think is available in Canada just yet. And this is a device that you're supposed to wear while you're sleeping. And so basically, you try to match the pitch and loudness of your tinnitus, or you match the pitch of your tinnitus. This sound produces the sound that sounds like your tinnitus while you're sleeping, which I know seems counterintuitive, but the thought process behind this is that while you're listening to a sound that sounds like your tinnitus while you're sleeping, your brain is learning that this sound is non-threatening and therefore reduces or decouples that fear component of your tinnitus with fear.
Connections to environmental allergies.
Oh, connections to environmental allergies. A variety of things could be happening with that. Sometimes when we have environmental allergies, it can result in uh, irritation. And so irritation can then result in making the tinnitus appear louder. In addition, if you have environmental allergies, it can cause sometimes sinus congestion. That sinus congestion can result in the tube that connects the back of the sinuses to our ear to close up, which can result in impact on our ability to hear sounds. And so if our ability to hear sounds is reduced, then the tinnitus may become louder or appear louder because we're not hearing sounds in the environment, which thus otherwise might mask the tinnitus.
Could you restate the name of the product that stimulates the tongue?
I think it's the Lanier product, Lenire. I could be mistaken.
Okay.
That's not available in Canada yet, but if you go to the website, you can find locations within the states.
Is there a connection to sensitivity to sounds?
I think the auditory system is a complex system, and so there are several phenomenons with regard to sensitivity to sounds. Tinnitus is somewhat separate from this. There's a phenomenon called misophonia, where there's an emotional sensitivity to sounds, so an emotional attachment to sounds. And that sound could be something as simple as someone breathing, someone chewing, even your pet licking can cause an emotional reaction. This is called misophonia. There's also phonophobia, where sounds may cause fear for an individual. Tinnitus is not caused by these types of things, but because it all has to do with the auditory system, sometimes our therapies or recommendations for tinnitus are also the same recommendations and therapies we might have for fear of sounds or for stress reactions to sounds.
I've got one more question here, Jack.
Sure.
You okay? You're
Oh,
doing
yeah.
a really great job at handling all these questions. This one is a little bit related to tinnitus. Is the phenomenon of water in the ears? Does that have a connection to tinnitus? And also, just what happens to water in your ears? Does it just dissipate, or what happens?
So that depends. It may depend on where the water is occurring. And so if you're talking about water in the ear canal, like after showering or going swimming, typically that water will just sort of drain out. Can that water cause tinnitus? Typically not. But if that water is sufficient enough, it'll block out the sounds around us and give us a temporary hearing loss. And if you have a temporary hearing loss because the water's not allowing sounds to get to the hearing organ, the tinnitus may sound louder because there is no contrast between the background noise and the tinnitus. If you're speaking about fluid behind the eardrum, that water will typically get either reabsorbed by the body or it will drain through the tube that connects the middle ear space to the back of the sinuses. That sound will not cause primary tinnitus, but that phenomenon may not cause primary tinnitus, but it may cause secondary tinnitus. Again, because environmental sounds are blocked out, the auditory system is making a sound or is looking for a sound, and therefore it might sort of identify the tinnitus. So I had, in addition to primary tinnitus, which is what I have, I also one time had secondary tinnitus on top of my primary tinnitus because I had wax in my ears. And so with both together, the tinnitus seemed a lot louder than what I was used to. But once the wax was cleared, just like we would assume if the fluid was cleared, ideally the environmental sounds will help mask out the tinnitus.
Jack, I'm going to stop us there.
Sure.
I think you've got people really letting saying thank you for a great presentation. Some people saying that they weren't thinking about their tinnitus till you started talking about it.
And now it's bothersome. And yeah, I know that's one of the downsides within audiology during our case history sometimes. Well, we do have to ask about tinnitus, and patients will sometimes say, well, it wasn't bothersome until you started asking me about my tinnitus, and now I can hear my tinnitus. But of course, if you have any questions or are interested in learning more about tinnitus, feel free to send me an email.
Thank you. Thank you very much. Some people asking about the recording, which will be available in an email to participants, I believe, and asking about your slides. So I guess they'll see those in the recording. I also want to remind people about our next two May month webinars. Next Wednesday at noon, we have a webinar on play and book strategies for children with autism, autistic children. And then the following week, we have strategies for individuals with Parkinson's. So we want to thank you very much for joining us today at our webinar.
Thank you.